Hello, I'm Dr. Diane Webster, and this short story documents events that happened in 1984 in a specialist training program in Australia. It's typical of the so-called toughening up process deemed necessary for doctors in training to survive this entire training program at the time and eventually become medical and surgical specialists. The training program, Parkville, June 1984. Central Melbourne Hospital, Parkville. There's a pecking order in hospitals. The head of the unit is at the top, followed by the other consultants in the unit. These are highly trained specialists, experts in their field. Below the consultants are the fellows. These doctors may be already specialists, but are doing further subspecialty training. Then there are the senior registrars, followed by the junior registrars. These doctors are all in the training program of a specialty in medicine or surgery, learning to be consultants. Then come the residents, then interns or first-year doctors, followed by the medical students at the very bottom. It is hospital etiquette that each level figuratively bows to the next and pays them due respect. This is the way it usually happens, but not always, as I was yet to learn. 8:15 a.m. I'm going up in the lift at Central Melbourne Hospital, or CMH as we call it, up to the theatre operating suite. In the lift with me are my superiors, my consultants, Dr. Dick Galbrain, the head of the eye unit, and two other consultant ophthalmologists on the unit, Dr. Bruce Carlsford and Dr. David Kleinman. I'm not long from starting my 6-month rotation at CMH as part of my ophthalmology training program. Dick has a reputation of being a tough boss as head consultant ophthalmologist of the unit. There are several eye surgery lists this morning. I'll be operating with Dick though. He'll be teaching me. Before I started at CMH, in the 3rd year of my training program to become an ophthalmologist, I was always ready to do exactly as I was instructed by my superiors, the consultants, who are all fellows of the Royal Australian College of Ophthalmologists, or RACO as it was abbreviated. This was my goal, to become a fellow of the college and be registered to practice as a specialist ophthalmologist in Australia. I had no idea that my rotation at CMH would be pivotal in the toughening up process that was deemed necessary to become an ophthalmologist. Dick Galbrain began his rant in the lift. Well, Alice, you've got to learn to operate under pressure, and you've got to look as good at the end of the list as you do at the beginning. So, I'll be putting you under some pressure today. It's your 3rd year in the training program, final exams coming up. You've got to learn to operate ambidextrously. Be as good with your left hand as you are with your right. What side of the bed do you sleep on, Alice? Dick asked me. What's that got to do with anything, I'm thinking. Yeah, as good with your right hand as you are with your left, eh, boys? He snidely said to the other two consultants with a wry smile. Oh, that's what he's talking about, I thought. Typical Dick. Everything is about sex, and if it's not about sex, it's about the toilet. By the time Dick walked into theatre, I had already started the case. I really don't know why we bother teaching you girls surgery, he said casually as he walked in, and to no one in particular. You're only going to get married and have children and stop working anyway. We like the girls in the anaesthetic training program, chimed in the male anaesthetist. That makes fewer male trainees, and like you said, the females are not going to practice anyway, so less competition for the good surgery lists available for us consultants. Hand me the clay-coloured stool, Dick said with a chuckle to one of the nurses. I'd like to be seated. Typical, I thought. Now we will have the toilet jokes. Another name for a stool is feces or poo, if you like. Patients have a clay-coloured stool when they have liver disease, so there's the pun. Ha ha. What do you think you're doing, Alice? Stop! Just stop! Dick suddenly shouts at me. Luckily, the patient is under general anaesthetic, I thought. I nearly jumped out of my operating chair with the shock of his loud bark, and I instantly took my micro-instruments out of the patient's eye. I thought I told you in the lift that you were to operate with your left hand only this morning. I'm trying to teach you to be ambidextrous, he roared. I immediately changed to operating with my left hand only, which was difficult because I am naturally right-handed. This was microsurgery we were doing, very delicate work inside a patient's eye under the microscope. I was thankful I had learnt by this stage of the training program to work with my 2 hands and fingers independently while my 2 feet were working the microscope pedals and the phaco machine pedal. But now I had to do the remainder of this case with my left hand only, and this was going to be very challenging. I continued with the cataract operation, much slower now, because Dick was standing over me, making sure I was only using my left hand. All the while, Dick is laughing and joking with his classic toilet and sex jokes with the male anaesthetist. You're taking a while, Alice. I'm going to the tea room. Come on, left hand only, remember, and I'll send Bruce in to keep the pressure up while I'm gone. He sent in Bruce Carlsford to look over my shoulder. I'd just broken the posterior capsule. Can I use both hands now, Bruce? I'll need to do a vitrectomy, I said. What the bloody hell? Bruce exclaimed. Dick's been forcing you to use your left hand only, hasn't he? His favourite trick. The operation took at least 3 times longer than usual. I was exhausted. At the end of the morning's operating, standing in the lift alongside the other 3 consultants. Well, how are you feeling, Alice? Got to look as good at the end of the list as you do at the start, remember? Barked Dick, with his signature loud guffaw. I'm fine, I said flatly. Next morning, 7 a.m. Morning, boys, Dick yelled to the other consultants in the boardroom as we entered the room together. Dick and I were attending the monthly head and neck clinical meeting with the other ENT surgeons, neurosurgeons, facio-maxillary and plastic surgeons of the hospital, along with a few registrars. The meeting mostly consisted of presentations of patient cases and discussion of their management. I brought my little piece of fluff with me this morning, boys, yelled Dick from the door as we walked through it, obviously referring to me. All the doctors at the meeting were indeed all boys, or rather men, not a woman among them, except for myself. They all turned and looked at us. This is Dr. Werner. She's our new senior reg on the eye unit. She's mine, and she'll be with me for breakfast for the next 6 months, Dick chuckled with a smile on his face. I could feel the heat from my cheeks flushing scarlet with embarrassment. I said nothing. After the meeting, Dick and I were walking to the eye clinic to start the morning's consulting. I'd like you to come with me on the Solomon Islands trip coming up in a few weeks' time, Alice. I think you'd like sharing a room with me, and if you do, you can be certain to get an excellent end-of-term report from me, he said confidently. I was shocked. I knew Dick regularly did these humanitarian trips to the Solomon Islands to do cataract surgery. I also knew that going on one of these trips was voluntary, not a mandatory part of the training program. He was basically asking me to sleep with him on this trip in order for me to get a good end-of-term report. These end-of-term reports were a necessary benchmark for me to pass towards my successful completion of the training program in ophthalmology. Not only that, but he was supposedly a happily married man with children and also the current president of the Royal Australian College of Ophthalmologists. The college was my authorised training authority that would issue me with my fellowship certificate after successful completion of my 4 years of training and passing the final exams. I didn't reply to his request. 9:15 a.m, eye clinic, CMH. One of the male ophthalmology fellows who had been working at the hospital for the past 6 months, Dr. Eric Forster, walked into the clinic. He was late. We had already started seeing the patients. In the hospital pecking order, he was more senior than me, but Dick and the other consultants were his superior. "You're late, Forster. What the fuck do you think you're doing?" Dick yelled at him as he came in the back clinic corridor, but everyone could hear him say it, including the patients. "Get fucked yourself, Dick," Forster shouted back. Again, I was shocked. How could a more junior doctor speak like that to a consultant? I was surprised to see that Dick said nothing more. He just resumed examining his patients. So, that's how it's done, I thought. You have to speak back to Dick in a language he understands, the language he uses himself. You just have to stand up to him and he'll lay off you, I thought. I've been doing everything he told me to up until now. And the way he was treating me was just getting worse. I had to change tactics. 11 a.m, eye clinic. The cubicles where we examined patients on the slit lamp were open at the back to a wide corridor so the doctors could move easily between exam cubicles. This also meant we could hear everything that was said in the next door cubicle. I was reading up on a patient file before bringing a patient into my cubicle when I overheard Dick speaking in the back corridor to the other two consultants, Dr. Bruce Carlsford and Dr. David Kleinman. "She's wearing a nice low-cut top today, and if you come up behind her quietly while she's examining the patient on the slit lamp, you can get a really good look at her tits." I heard Dick say this. I was incredulous. I couldn't believe what I was hearing. So I waited about 2 minutes and then I turned around and walked to the edge of my cubicle to see who he was referring to. There was a new female junior resident doctor, Anne Milne. She was wearing a rather low-cut top and intently examining a patient on the slit lamp. The 3 much older male consultants had silently crept up and were standing just behind her, looking down her cleavage, while she was seated at the slit lamp, concentrating on performing a patient examination through the oculars. It was worse than bad boy schoolyard behaviour, and it was actually happening in the ophthalmology clinic of CMH. It only lasted a few minutes, and then they dispersed. I guess the other 2 consultants were only involved to please their boss and keep him happy, and that's why they would go along with his smutty behaviour. 11:45 a.m. I went up to the ward to see Mrs. Sutherland, the patient I had been instructed to operate on yesterday by Dick with my left hand only, and who suffered a posterior capsule rupture and prolonged surgery because of it. When I examined her on the slit lamp, her eye was red and painful. She had no vision in the eye, and the anterior chamber of her eye was filled with pus. Dick turned up on the ward and examined her after me. He stepped back and asked the nurse to take the patient back to her bed. Then he said to me, "Well, there's an eye that'll probably end up in the bucket." He was referring to the fact that this poor lady's eye would probably have to be removed because it would not recover and would otherwise remain blind and painful. Dick turned to leave, and I found the courage to speak up and say to him, "Dick, I won't be going on the Solomon's trip later this month." "That's too bad," Dick said quietly as he walked away. At the end of my term at Central Melbourne Hospital, I found out that Dick had indeed given me a less than glowing report for the term, but it was a pass. It was in stark contrast, however, to my other term reports from other hospitals where I had trained, which had given me uniformly good reports previously. When I finally passed my exit exams and completed the training program, I found on the bottom of my fellowship certificate the name and signature of the president of the college, Dr. Dick Galbraith. 2 years later, when I became a practicing ophthalmologist in Brisbane, Queensland, I came down to present a case for discussion at the Victorian Branch Ophthalmology meeting. I made my presentation about laser suture removal of deep scleral sutures following glaucoma surgery. Following this, Dick stood up and barked at me in front of the large group of my peers filling the lecture hall. "Well, that's a really stupid idea you've thought up, Alice. It's much better to just cut the bloody suture with a needle." I barked back, "Well, it's an even more stupid idea to cut the conjunctiva with your proposed technique, Dick, as it risks infection and bleeding. With my technique, there's no bleeding, and because the conjunctiva is not breached, there's much less chance of infection." Dick sat down and muttered something under his breath to a friend of mine he was sitting next to, Dr. Chris Rees. I went up to Chris at the morning tea break and asked him what Dick had said about me. He replied with a smile, "Oh, he just said, 'She's got balls now, hasn't she?'" I took it as a compliment. I was giving him back what he deserved.